Hi guys, my name is Nikki. I'm lead vet tech with Apollo Pet Braces, and today I just want to talk to you about surgery versus bracing. So first off, with surgery, there's a lot of reasons why a patient can't have surgery. Let's say they're not a good anesthetic patient. Maybe they have liver enzymes that are elevated. Maybe they're overweight, or maybe the owner doesn't have the $10,000 to spend on both the first knee and then almost a guarantee the second knee if you have surgery. So there's lots of reasons why patients might not be a good candidate for surgery. Now also, surgery has a lot of risks with it. So with surgery, what I've seen in my end, and I've literally worked with 6,000 patients at this point. So I have seen a lot of knees, and a lot of these patients have had surgery on one knee. So I see a lot of the complications, and most frequently is the large breed dogs. So we've got our Great Danes, our Mastiffs. They have surgery. That's a lot of weight. You're literally sawing a bone in half, realigning it and screwing it back together. So those screws can bend. We see infection at the incision site, sutures having issues. I also see fracturing, especially if you have a TTA done. The latest one was a Great Dane with a TTA that had fracturing at the site. I've had some patients that have literally had 4 surgeries within like 3 or 4 months because they just could not get the movement to stop. And so in that case, unfortunately, some of those patients end up having amputations done, and then hopefully we brace the other knee so that we prevent an injury on that side. So again, a lot of risks involved with surgery. Versus bracing, there's basically no risk. We have patients that as soon as we put the brace on, within 24 hours, they're usually not overcompensating any longer, and they're able to put full weight back on that leg. And so because of that, we're stopping the tibial thrust, we're allowing scar tissue to form, and at the same time, we're going through physical therapy with our patients, we're talking about supplements, our vet techs are on the phone with you, we do FaceTime calls, so we see your puppy, and we watch them walk around and we can see kind of what's going on. Our techs are there for you, so if you have questions about like the procedure or the process, or if we need any adjustments done, we do that all over a video call. There's no need to go back to the veterinarian. So we have a lot less complication risks with bracing versus doing surgery. Also with surgery, you've got 8 to 12 weeks minimum that your dog is going to be in a kennel or confined. So because of this, there is going to be a lot of atrophy set in. So because there's atrophy, it kind of starts a spiral. And unfortunately, I don't see a lot of surgical patients going home with a good physical therapy like regimen, like we do here at Apollo. And so when those patients are going home, they're being kenneled for 8 to 12 weeks. They're sent home with pain medications. Those dogs barely come out for walks. Maybe sometimes they do. So they're depressed. That muscle starts wasting. And after 12 weeks, we start walking again, but we definitely have atrophy. And during that time, they've been overcompensating meanwhile on their other joints. So now our front shoulders and elbows have overcompensated, and our other knee, which is another reason why the second knee will go usually with the surgery patient. Versus with bracing, we stop that overcompensating again right away, and our patients are able to immediately start walking. They can go outside and have full range of motion on that joint, but at the same time, we're stopping that tibial thrust, so they're way more comfortable. So in the end, I just want to close with, remember, you can't undo surgical complications. Once you have surgery, that's a major thing, and you can't undo it if something goes wrong. With bracing, we have a lot of options. There's a lot of things we can still do with conservative management. So definitely do your research, and please feel free to ask if you have any questions. Again, it's Apollo Pet Braces. Thanks and have a great day. Bye-bye.